Well, good evening or good morning or good afternoon. I think it's good evening for me. It's good afternoon to you. I am Susan Ryan. I am the CEO for the Center for Innovation, and it is the proud home of the Greenhouse Project and the Pioneer Network. And it is my distinct honor to be with you and to really share my personal passion and really professional pinnacle for my career. And that is my experience with the Greenhouse Project. Just to let you know a little bit about who I am, my background is that of a nurse. I have worked for decades now in the field of long-term care in the United States. I have been a director of nursing in a nursing home. And at one point, it was that time where I thought it's time to get people out of nursing homes and into home care because it wasn't that respectable place where I thought people should grow older in a dignified way. And it was about 2005 that I heard about the Greenhouse Project, and it really rocked my world and it really changed my world forever. I joined the Greenhouse Project team in 2008. And like I said, it has really been the pinnacle of my career. So tonight, this afternoon for you, I'm going to share a few slides and just talk to you a little bit about my experience with the Greenhouse Project and really a bit more about kind of who we are, what we do, and how, in my opinion, it is really that opportunity to reimagine aged care and to really think about what's possible through the lens of the Greenhouse Project. So what I'm going to do first is set the context a bit. I really thought it would be helpful for us to kind of get an idea in terms of what we know about nursing homes or aged care as it is in New Zealand. The reality is the world is changing. The demographics are such that I don't care where you are. We are experiencing a new time, a new day where the baby boomer population of people, there was a baby boom, and no matter where you are in the world, the demographics are shifting in such that the world is growing older. I can tell you a little bit about the US. Here are some of our stats, and you can see where it's shifting, where the older population is growing, the younger population or birth rate is decreasing. I did a little Googling. This is just to let you know where we are with nursing homes in the US. We've got 15,000 nursing homes, and they were built when government started funding nursing homes. We started building a lot of them, and you can see 140% growth from 66 to 1975. But we modeled them after hospitals, and it really was designed for institutional efficiency and as hospitals were. So there was very little variation, and it really was all about task-centered care. I find it interesting, one of our government officials made a comment in 1979, and he described our nursing homes in the United States as halfway houses between society and the cemetery for the elderly. Not a great commentary on nursing homes for the US. And so over the years, there have been many studies that have been done. There have been many nursing home reform acts that have been created. And in my opinion, until the greenhouse model, we really haven't had much hope. So as I was saying, I did a little Googling to see, so what are your stats? What does it look like demographically speaking for New Zealand? I found this from AARP International, and it says that today, and this is in 22, a little before 22, more than 700,000 people age 65 and older make up more than 15%. But they said that by 2032, New Zealand will become a super aged society when the percentage of people age 65 will exceed 21%. Another headline that I looked at with your stats said 1 million people aged 65 plus by 2028. So you can see that New Zealand is no different from the rest of the world. The world is aging, our demographics are shifting, and it really requires us to think differently about what we're going to do to really address the problem associated with these shifting demographics. This is an interesting one. This is really about workforce and really thinking about the age of our workforce and really thinking about who do we have that is ready to come into the workforce. And as you can see, in 2022, which is the latest in the bar graph that I'm showing you here, this is New Zealand and your workforce. And it is showing a very low number of people when you look at across here over the years since 1990, a really tragically low number of people in that age space that will be contributing to your workforce in New Zealand. Here's another headline that I took a look at. A shortage in care and support service is looming as New Zealand population ages. So in the next 3 years, an extra 16,000 carers and support workers will be needed across healthcare, aged care, and disability sectors. So I'm sure I'm not telling you anything you don't already know. In fact, you're feeling it probably more acutely than I could even begin to explain to you. But I'm just, I think, trying to set up the fact that the reality is it's a global aging phenomena. And it is an opportunity for us globally to rethink what do we need to do to really identify solutions that are going to deliver the dignified, humane opportunities to provide that dignified aged care that we would all want for ourselves. The other thing that I found striking, and ageism is rampant in the United States, I would say ageism is rampant globally. And in fact, another thing that I found in New Zealand as I did some of my Googling is that 20% of people over 50 have reported feeling invisible because of their age. So here's what I offer as a solution, and that is the greenhouse model. And you can see from this picture, this is a greenhouse home in Rochester, New York. But what you're looking at is actually a skilled nursing facility. It's long-term care for 10 people, 10 private rooms for those that are needing long-term care. So let me tell you a little bit about the history of the greenhouse model. We've got 400 greenhouse homes, and they are spread across 35 states. So that's where we are today. But the history goes way back to, I'm sure, perhaps a familiar face to many of you, and that is Dr. Bill Thomas. Dr. Bill Thomas is a geriatrician. He was Harvard educated. He was a medical director in upstate New York. And it was a time when he went in to see a resident who had a rash on her arm. And as he went in to see her, he saw the rash and he began to write something in her chart. And she said, "Doctor, I am so lonely." And it was the way she looked at his face. And he said he realized that he did not have something in the formulary to really address the real plagues of loneliness, helplessness, and boredom that was afflicting those that were living in nursing homes. And so he and his wife, Jude Thomas, would develop 10 principles, and he began the Eden Alternative. And I'm sure I happen to know that it is in New Zealand. And the Eden Alternative was just an amazing thing. I remember hearing about the Eden Alternative in the 1990s when Dr. Thomas and his wife were going around the country and really around the globe to really share their message of how they were deinstitutionalizing those sterile environments and bringing life and meaning into those homes. But more than that, I think what was incredible in Dr. Thomas's visits to these aging buildings, he realized that the buildings were aging more quickly than the people inside them. And those two words, what if? What if we were to rebuild these aging infrastructure and really create something that would have the opportunity for the Eden Alternative principles to live, grow, and thrive? And so what he did was to come up with the greenhouse model. And so the Eden Alternative really was the precursor to the greenhouse model. and created the vessel, the vehicle, the physical structure for those Eden alternative principles to live, grow, and thrive. So it really begins when I think about the greenhouse model, it really for me is kind of starting from asking this simple question. It's what would you need? When I think about my tenure in aged care, it was really all about what do they need? What do those people need? Instead of what do I need? What do you need to be able to live life on your own terms? And so it really is starting with asking that simple question. And when you think about it for yourself, what would you need to live life on your own terms? And that's the frame by which we really think about the greenhouse model. So, with that, it's really thinking very comprehensively about how do we radically transform the paradigm. And I think in the US, it is an institutional paradigm. As I mentioned in the earlier slide, we really have modeled after hospitals, which was a very institutional setting, a very task oriented, very efficiency minded system. And it's time that we radically transform that paradigm. It's where we comprehensively change it. And I'm going to talk a lot about the physical environment. But if we reduce it to just the physical environment, we will have missed a big part of what the greenhouse model really is. So it's that physical shift in the environment, but it's a philosophical culture that will fill the physical environment. And even probably most importantly, and how important is workforce nowadays? And it's to think about what are we going to do from an organizational structure, from a workforce perspective, to really ensure that our workforce are mobilized, that our workforce are really empowered to be able to do those things that will enable that philosophical culture to come to life. And more than that, it's sustainable change. I can tell you in my tenure of decades of being a nurse, sustainable change, it was all about getting it done. It was often, if there was change, it was the quick fix. What can we do to get something done? And with the greenhouse model, it really is focusing, what about sustainable change? So the first core value that really embraces the physical environment is real home. We're not talking about home life. We're talking about a real home. What you're looking at here is a home in Longmont, Colorado, one of the states kind of more on the western side of the US. And this is a beautiful home for 12 elders. So on the next slide, I'm going to actually take you through a virtual tour of a greenhouse home. So just sit back and we're going to do a tour of greenhouse homes that opened in Providence, Rhode Island. So here we go. I'm going to turn on my video to make sure we've got the sound.
Welcome to the Greenhouse Homes at St. Elizabeth Home, a new and innovative model of nursing home care. These 4 greenhouse homes are each nursing homes for 12 individuals. St. Elizabeth Community is proud to open the first greenhouse homes in Rhode Island. Located on a cul-de-sac adjacent to St. Elizabeth Home, this intimate residential setting is unlike any nursing home in our state. Offering both privacy and autonomy for the residents, the model of care is a proven model which employs cross-trained certified nursing assistants and nurses. Let's take a look at one of the 4 greenhouse homes at St. Elizabeth Home. Upon entering the home, you come into the hearth room, a warm and inviting space for gathering, with a gas fireplace and a large wall-mounted TV. A sunny sitting area is off the hearth room. The den, adjacent to the hearth room, is an ideal place for reading, playing games, or visiting. Doors can be closed for privacy and quiet. The entire home has radiant floor heating, which provides exceptional warmth and comfort. The heart of the home is the spacious kitchen and dining room. An open floor plan encourages community and fosters interaction. The kitchen is inviting and designed so residents can easily help in preparing meals or simply enjoy being in the kitchen. The dining room table is large enough so that all residents and staff can share meals together. And families are welcome to enjoy a meal with their loved one individually or with the community. Each private bedroom has been thoughtfully designed. A built-in locked medicine cabinet is located at the entrance. Rooms are fully furnished and have cable and Wi-Fi free of charge. Individual heating and air conditioning controls give residents the ability to adjust temperature for their personal comfort. A built-in ceiling track would allow for a resident to be lifted from bed to bathroom if needed. All rooms have private, accessible bathrooms with walk-in showers. A call system is in place in bedrooms and bathrooms so residents can alert caregivers. A master bathroom has a whirlpool soaking tub and adjustable hairdresser sink. The spacious room has a large mirror and heat lamps in the ceiling for extra warmth. A courtyard and screened porch complement the beautiful interior space. Residents are invited to participate in daily activities they enjoy. Laundry is done by the staff, but if a resident or family member prefer doing their laundry, they are welcome to do so. The greenhouse home concept of living empowers staff to support residents to live life to the fullest in a real home with privacy and community. Thank you for taking the tour of the greenhouse homes at St. Elizabeth Home.
I hope
For more information,
you enjoyed that video, and I hope it gave you an idea of what a greenhouse home really looks like. Interestingly, that is a home that just about 2 weeks ago, I was able to show some individuals from ARIA. They're out of Adelaide, South Australia. They were in the US visiting innovative models across the US, and actually, they're doing a global tour of innovation. And while they were in the US, they asked if they could come see greenhouse homes. And what I just showed you was the community in Rhode Island that they were visiting. And so you just saw what the folks from ARIA were able to see as well. But lest you think that greenhouse homes are all single family homes, we've got greenhouse homes across the country that are built in very different sizes and shapes. Because the reality is our homes are all different. And we believe homes should look similar to the surrounding community. So we've got 2-story homes, 3-story homes, and our tallest right now is a 7-story home. That's the one in the middle, and that is in South Florida. The one on the right is the 6-story home, and that is in Boston. The group I was talking about, ARIA, they also just visited Boston as well. So it should be according to what the community is and really look very similar to what's comfortable. There are more urban areas in which, a multi-story home would be most appropriate. But what's most important, and this happens to be the home in Boston, a very urban area, is that those spaces are warm and inviting, that really invite the camaraderie of family. This is a hearth area. This you'll see, to me, you don't see something like this, at least in the US, in terms of a nursing home where you've got multi-generational really sharing a moment in the home. This particular community in Boston, they have homes that have a home for those living with Lou Gehrig's disease, ALS, homes living for people that are supported by ventilators. During COVID, they had a local hospital that said, "You do such a good job caring for really highly acute residents. We would love to be able to transfer some of our ventilator patients to one of your homes if you could open up a home for us to be able to do that. And in fact, they did that. So the greenhouse homes are able to care for the acuity of residents, even through ventilator care, which is pretty significant. And that is the case for the homes at Leonard Florence Center for Living, and that is in Boston. But again, those real home is inviting spaces. It's private rooms and private baths. You can see that this happens to be Colorado, but the wheel-in shower, the ability to be able to get in that shower, very accessible. Private rooms are so important. And when you think of the pandemic, how important was a private room to mitigating the spread of the infection? Real home means that we've decentralized our dining departments, our kitchens. And so every home has a kitchen, an accessible kitchen. All meals are prepared in a greenhouse home, and they eat those meals around one table. That sense of family dining is so important. Easy access to nutrition and hydration. Once again, speaking as a nurse, when you're able to do early detection to mitigate the spread of infection and have access to the nutrition and hydration that's necessary to be able to customize those meals to meet the needs of each unique person that's living in the home. How important is this as part of that physical environment that really helps to shape and define the type of care, and once again, that radical transformation of that paradigm that has been characterized by the institution. I think my favorite during the pandemic was access to outside. I don't know about you, but being quarantined to a room and not being able to get outside would have been really painful for me. I needed to be outside. So I'm going to just tell you real quick stories about each of these. The gentleman on the left, this is in Tupelo, Mississippi, where we just celebrated 20 years of greenhouse living in Tupelo, Mississippi. But during the pandemic, they got very creative and they said, we can get the residents outside and we can do what they called a quarantine. Instead of a barbecue, they called it a barbecue under quarantine, and it was a quarantine. And they fired up the Barbie and they were able to really get everybody outside and keep that physically distance, but yet enjoy the camaraderie of good food with each other, enjoy the fresh air, the sunshine. To the right, it was really interesting how many gardens were growing during the pandemic, and they were able to get outside, get their hands in the dirt, and really experience the joy of bringing something to life. When, let's just be real, there was a lot of death, there was a lot of unhappiness going on, but it was an opportunity to really grow seeds of life, meaning, and purpose for those in greenhouse homes. But once again, unless you think it is just about a small house movement, far more than that, and take these words very seriously, I do. It's deinstitutionalizing, destigmatizing, and humanizing care so that everybody lives meaningful and purposeful lives. So the second core value, really getting to that philosophical culture, is about meaningful life. It's really about creating a life that has meaning and purpose. This is Oda. Oda grew up in Iowa. She was a farm girl. And when she moved into the greenhouse home, she was given 6 months to live. She was on hospice. And the family didn't really believe she had much more to give. But in a greenhouse home, it's all about deep knowing relationships. And as they got to know who Oda is and who she had been in her life, they realized that what a meaningful day, what a meaningful life would be for Oda would be to get in the dirt, to really be able to work with those plants. Oda lived another 3 years because she had meaning, she had purpose, and they knew who she was through those deep knowing relationships. Relationship rich, person directed living. Don is another story. He moved into a greenhouse home in Montana, and he was given less than 6 months to live on hospice. But when he heard they were growing a garden, he said, I know a little bit about gardening. And so it was, he helped them. bring the garden to life. You can see the tomatoes that's kind of in his little walker. And it was one day the administrator was going home on a Friday afternoon, and she saw Don to the side as she was leaving. And there was Don with his basket of tomatoes, selling his tomatoes to whomever would stop and buy those tomatoes. That's person directed living. That's through deep knowing relationships, knowing who a person is, that they're able to bring that meaningful life. This is a couple living in their greenhouse home, and they were celebrating a milestone anniversary. And it was during the pandemic. So, what's one to do? Let's take the party outside. They got the cake, they got the bubbly, they got everything they needed to ensure that this couple had a celebration that they would remember. And they didn't let a pandemic stop them from such a thing. It's about seeing the person. It's about knowing who that person is. Yes, we want to understand their diagnosis, but let's see the person and understand that person is somebody with intrinsic worth, a unique individual, and let's know who that person is. Deep knowing relationships, that's the bedrock of everything that we do. Relationships, relationships, relationships will enable us to engender that meaningful and purposeful living. But I think one thing that I've always, or what I've learned certainly with greenhouse homes, is that it's not just as a nurse I always gave care to, but it's that reciprocity. What does that elder have to give back to me? And how do we ensure there is reciprocity? How do we really honor our elders and really listen, learn, and give opportunity for that elder to give back? Reciprocity and what it looks like to be in a care partnership. Last but not least is empowered staff, and that is that organizational redesign. When we really think about what are we going to do as it pertains to our staff, how do we really see them as people, and how do we ensure that they are fully empowered to be a part and engaged in engendering that quality of life experience that we're talking about for our elders or residents? So the philosophy for an empowered staff is really about growing people. I think most of us understand what a greenhouse is, one word, and that is to produce an environment that produces optimal growth in plants. Greenhouse, two words, is about really producing optimal growth in people. And so with the greenhouse model, it's a really interesting model. An empowered staff means that team, that care team, the direct care worker, in the US, we call them a certified nursing assistant. They receive about 128 hours of additional education to equip them to do not just the care, but to equip them to do the cooking, to do the laundry, to do the housekeeping, to do the meaningful life and engagements. And we really get them well steeped in the greenhouse philosophy and what that looks like. They're essentially household managers. I find this picture in the middle here, you see somebody actually caulking. So they got very creative during the pandemic. And when you think about the consistency of the staff that were going in and out of greenhouse homes during the pandemic, there was something so powerful about that experience. And the fewer people that were going in meant the less chance that that virus was going to be brought into those homes. So the consistent staff, you had the same staff going in and out. You didn't have dining trays coming in. You didn't have laundry carts coming in or different housekeepers and carts coming into homes. You had the same consistent team of people, and they were doing all of those tasks wrapped into one. So the staffing model for a greenhouse home, for a home of 10 people, you would have 2 care partners on the day shift, 2 care partners on the evening shift, and you would have 1 care partner on the night shift. In addition to that, you would have a nurse going back and forth between 2 houses on days and evenings and 3 houses on nights. So you can see that there's really that staffing model brings a lot of rich robustness to the model, so that you've got a consistency there with the team and that they're able to really deliver that care. If you have a 12-person home, you're going to adjust it accordingly. And typically on day shift, they would have 3 people for 12 residents. On days, they would have 2 on evenings and 1 on nights. And so oftentimes they will adjust that. They may say, well, need 4 kind of later in the day, kind of through that lunch period time, and then a little more support in the dinner time period. So they have that freedom, that autonomy as a self-managed work team to really be able to flex those schedules and make sure they've got the coverage that they need. So I think if I were to say anything about how do you really make this work, that sounds like it's a bit complicated. And it's not that it's complicated, but what I will tell you is that when I think about what makes a greenhouse home successful, one of the first things that I would say is that you can't have jump. You can't just say, well, I'll just build the small houses, or I'll do a little of this or a little of that. But it's really fully committing to what those core values really are and really thinking about what it means to completely, radically transform the paradigm. And that's a function of leadership. When I think about empowerment, empowerment is all about leadership. And it's leaders that are really creating a coaching culture. I can tell you, as a director of nursing, I learned how to tell people what to do. And I got really good at it, at telling people what to do, at making their assignments. But in the greenhouse coaching construct, it really is about listening. It's about really making sure that we've got all the right people at the table to do shared decision making. It's about establishing a compassionate culture. We are creating cultures where love matters and where compassion, empathy, and action come together to really ensure that life happens in meaningful and purposeful ways. So some of the ways that we equip for success, we're big on education. We've got a robust toolkit of education. We've got coaching classes. We've got the core education that really equips the care teams to be able to kind of do everything that they need to do to be equipped with all those skills. If we're asking them to do the cooking, well, then we need to equip them with the culinary skills to be able to do it. If we're asking them to be household managers, how are they ordering their food? How are they getting their cleaning supplies? What do they need to know to be able to be efficient and successful and being able to be those household managers? And it's not our education is not just we're going to check the box and say, okay, we're done, we did that education. But it's then what do we do with that knowledge? How do we apply it? How do we make it relevant? Learning is a process, not a check the box event. And the other thing is, how do we share information? How do you disseminate that information? How does information from this shift to the next shift, change of condition, what does that look like? And how do we really ensure that there's ownership of the roles and the responsibilities for all those that will be working in the house? And last but not least, it's really balancing support and accountability. I think oftentimes in greenhouse homes, it's really thought that it's, you've empowered the team and they just kind of do it and run with it and there's no accountability. No, not so much. That it really is giving them all that they need to be successful and holding them accountable to really making sure that they're able to do everything that they need to do and they're held accountable to that job. That's what a coaching leader does. I think one of my favorite stories is of a woman who was, I guess she was in her late 40s, and she was a certified nursing assistant. She was learning to become a Shabazz, which is what we call the direct care worker in a greenhouse home. And she was fear and trembling, thinking about how in the world was she going to learn how to cook meals. And when I talked to her, I said, Patty, I can't understand why you're so concerned. You're 48 years old and you've got 3 children at home. You're a married woman. Why cooking seems like this would not be a new thing for you. And then she let me know that her husband had done all the cooking in their married life. And she said she never learned how to cook. And that she said outside of freezer to microwave or fast food, she said she hadn't really ever learned how to cook. So taking her through the culinary training was really significant to her. And when I came back to see her about 6 months later, she was beaming with pride. And she told me how satisfied she felt. She said, I'm making dinner for my family now. And my family tells me I'm a better cook than my husband. And so that sense of pride, that sense of achievement, that sense of growth that she was experiencing. When I think about workforce challenges, and I don't know where you are with workforce retention and how hard it might be to recruit. I can tell you in the States, it's a challenge. But I'm always asking, what are we calling people to? What type of job, what type of culture are we calling them to? Are we calling them to a job that has meaning and purpose? Or are we just calling them to another job? Are there opportunities to grow? Not necessarily that they want to climb a ladder, but do they want to grow as a person? Do they want to gain life skills? And that's what this model is really designed. When you think about workforce, it is a model that is really designed about growing people, as I mentioned earlier. So worker empowered, it's all about leadership. One of the things that I read a book during the pandemic, and we've incorporated a lot of this into our education. When I think about meeting core work needs, and I grabbed this from Compassionate Leadership. It's a book by Michael West, and he is out of the UK. But he talks about the ABCs of meeting core work needs. And I found it really powerful. A is for autonomy and control. How many of us want autonomy and control for what we do in our everyday life, whether it's our work life or personal life? We have a drive within us that wants that level of autonomy and control. And we want, as this says, to act consistently, having our work and our life values to really mesh together. B is belonging. And I think with diversity, equity, and inclusion, the B for belonging is where we all want to strive to be. And that is to be connected, to be cared for, and caring of others around us, to feel valued, respected, to feel supported, that you really belong to something. And C is contribution and competence. I think we all want that sense of purpose. We want to experience something that says we're effective, that I'm contributing to those outcomes that are so important to us. So thinking about an empowered workforce and thinking about those core work needs as something fundamental to our success. This was another quote from the book Compassionate Leadership, and I'm going to just read this because I found it so powerful to me. A new era is upon us, one driven by connecting people to their purpose, where value lies in our ability to contribute to something greater than ourselves, to grow as individuals, and to build community. And I think our care homes in the US, that's not typically what we're inviting them in to do, to help them connect to their purpose, to help them contribute to something greater than themselves. And so when I think about the greenhouse model, this is what we strive for, is to really create those cultures and those communities. And when I think about what we can do to society and the greater good, it really helps me. Helps me stay connected to what I do and to feel once again why I'm so deeply passionate about the work I do. Person directed and worker empowered. I think oftentimes we talk about person centered care, I like to call it person-directed care because it really puts the elder in the driver's seat who says, I want to be a part of directing my care, not just having it centered on me, but it's that autonomy and control for the elder as well. But in order to get there, we've got to understand the link between person-directed and worker-empowered. That link is strong, and you can't just run in silos. You've got to really make sure that we're connecting it. And so for me, it's really creating conditions where all those in community are supported to live the best and most fulfilling lives that they can. So I'm going to show you a video right now. Let me go back to that slide for 1 minute while I set it up. I've talked to you about the greenhouse model, and I've talked to you about what it would take to rebuild into a small house environment. And with the exception of probably about a handful of greenhouse homes, everything has been new construction. But there are those that have done renovation, either in a traditional building or they have renovated. I think we had a kind of a childcare center that actually was renovated into greenhouse homes. But I'm going to show you a video. This was done outside Manhattan in New York. And they said they envision a project that will be all new build greenhouse homes. They had a sister facility, and they said, but what we'd like to do is make sure there's alignment. And we don't have land to rebuild there, so we're constrained with land, but we'd like to go in and renovate into small homes. And so the video that I'm going to show you is the renovation they did within it's a 300-bed nursing home in Westchester, New York. It's just outside of Manhattan. And so so far they've built about 5 small homes within that traditional structure. And in this case, they are not greenhouse homes, they're small houses, but built very much according to the greenhouse core values. So can you do greenhouse in a traditional building? And the answer is yes. And so this is the story of Sarah Newman. So I'm going to show you that video now.
I have been going to painting, playing bingo. I like to sing, I like to listen to music.
I enjoy sitting in a den and having somebody like you to talk to.
I can't pinpoint it. I enjoy everything because I love life.
The Small House is transforming long-term care. Founded on the principles of the greenhouse philosophy, the Small House focuses on the needs and preferences of our elders and on daily life. The Small House takes the institution out of the institution and creates a home.
I'm 97 years old. I am still able to do most of everything for myself.
As long as I can walk, I'm
you do
going
it.
to do for myself.
Which is very good. And at the same time, we are there to assist you.
The role of the Ajarim here is to protect, sustain, and nurture all of our residents. And they do that by doing their regular CNA duties. They do the cooking for each and every one of the residents. They do the light housekeeping, and they do the activities. It's about deep knowing, working together so that they can become a self-managed team, and really trying to individualize and make it special for everybody.
It's your choice when you want to get up, and I love that about it.
I do too.
Our residents get to wake when they want to wake. People are casually coming in to breakfast. They're having special breakfasts geared to each of them.
I have juice, then I have cereal, then I have scrambled egg, Then I have coffee, which is always delicious.
Perhaps then sitting down, reading the paper, listening to music, and that starts their day in a very nice, calm way.
Eating in the small house is like eating in your own home.
We saw our ingredients, we moved them around in the pan.
The meals here in the small house are really a collaboration between the Adiram and the elders. The elder input in driving the menus is what makes the meal such a success.
I like spicy food, I like salty food, I like everything that's raw.
It's all fresh fruit, fresh vegetables.
You can smell the food as it's cooking. The food comes right from either the oven or the stovetop, right onto the residents' plates.
The food is more tasteful because it's being prepared in our own kitchen. These are girls that know how to really cook.
We have our nice big table. It fits all 13 of our residents, as well as staff members and family members who might be visiting.
We can sit and chit-chat.
That's right.
Carol, Sylvia, Doris, they're all people you can converse with.
I have a good book, I have the newspapers, whatever I have, that's my meat. These rooms are really made very comfortable. There's plenty of space. It's ideal. How can there be any complaints? Look at the beauty out there. I'm an outdoor person. Oh, yeah.
I'll be 94 years in a very short time, so I want to enjoy everything I have.
We know what we have and what we don't have.
It's a wonderful place to live.
It's my home now.
Time flies when you're having fun.
This is not a small house. This is large.
I hope you enjoyed that as much as I did. Every time I hear those ladies, I can remember visiting with them, and I love the New York accent, first of all, and certainly enjoyed the joy that they are experiencing in their home. So you can see that the small house within that traditional environment, when really fully embracing the greenhouse principles and core values, they went through all the education that we did, and certainly worked with an architect that knew the greenhouse design elements, and really were able to do some things that were pretty remarkable in getting things very close to the greenhouse model. So I'm going to leave you with this and then open it up for questions. We do have a Q&A box that you can put your questions in, and happy to take some of your questions. But I kind of put this out there to you. It's a moment in history where we must all rise to the challenge of changing organizational and societal cultures to value every human equally and to ensure there is equity and care for all. So with that, I am going to stop sharing. I'm going to open it up for questions. Really, one thing that I will say while you're perhaps getting your questions into the chat box, should you have them, is that we will be sending a recording out of this video, of this session that we've done with you all, so that you'll have that and the PowerPoint, and we'll send the video separately as well, so you'll have the videos to look at. We'll send our contact information as well. The other thing that I would say is I'm delighted to be working with Ann Coughlin and Fiona Woodbridge. We've really enjoyed getting to know these New Zealanders and really equipping them with so much of the greenhouse intel, and really consider them to be our ambassadors on the ground. So if you would reach out to us, we can certainly will be working with them to really fuel your interest and to really help resource you with everything that you would need. So with that, I'm just wondering if there are any questions from any of you, any comments, anything that you'd like to share with me tonight. Are there any greenhouse homes planned for New Zealand? Well, not yet, but we are certainly hoping that there will be some. We've just been in Adelaide, South Australia, so we're getting close to New Zealand. And it was actually Fiona and Anne. I met them there at a conference in South Australia just last May, And so I'm hoping that there will be some homes in New Zealand. It's a fabulous concept, and you've presented it comprehensively. Thank you. All right. I've done some background research before the webinar. This suggests the greenhouse model be implemented within a similar cost structure to normal aged care. How is this achieved? There seems to be a loss of economies of scale. That's often definitely something that many people think about. I would invite you to a webinar that we are doing on December 7th. There are ways that you can gain what you would call the economies of scale or the return on the investment. And the ways that you get the return on the investment is in turnover. If you are creating a place where people enjoy coming to work and you don't have that turnover, you're going to save on turnover. You're also going to save in the greenhouse homes. Our occupancy rates are here, where in traditional nursing homes, they're much lower. And so in the States anyway, the occupancy gains, the revenue that is gained by that is rather significant. Cost per day, we have found cost per day is actually less when you know who the person is and you can be proactive in addressing some of those concerns. Then you're going to save on the cost per day. Food cost per day, less waste in food, less supplement usage is what we're finding. So there are ways that defy kind of those economies of scale and the efficiency ways that we've always thought about. How do we provide care for people? So it's definitely, it's a place where I think we all would want to live. And there are ways to achieve that return on investment. We need to do something different for sure. Cost or consideration. And here's what I would say about the cost. And, this is certainly something that I'm working on in the States. I think we've got to kind of think about how do we incentivize what we want to see. I'm really working with our government to say, I believe that there should be incentives to create private rooms. I think there should be financing and funding that really has kind of that quality metric. If we know that private rooms did demonstratively better during the pandemic, then that's what we should be striving to do. And I'm really hoping that we're going to see some government incentives that will help us get there. I see staffing is legislated, staff numbers. The multi-skilled care concept would work, but RN costs may be prohibited. It is interesting, and certainly in the U.S., we now have staffing mandates that are being talked about. There are certain states that do have those mandates, and from an RN perspective, that is definitely being talked about as well. And I hear what you're saying, and I do understand these are all the challenges that we are all grappling with, no matter where you are. And I think, at the end of the day, it really is about that deep knowing and really just kind of working with our governments and the funders to really see what can we do to really, truly kind of build a system that is holistically and comprehensively caring for our elders in a dignified and equitable way. It's not easy, but and given the shifting demographics, I think, it's becoming a bigger and bigger problem to solve. But I think we have to work from that which we know is working well and that which did well during the pandemic, certainly. Any other questions? And I would certainly welcome your follow-up with me afterwards. You can reach us at thegreenhouseproject.org, and I'm certainly happy to respond to your inquiries there. Once again, we are working with Anne Coughlin and Fiona Woodbridge, and they are in New Zealand, and we are really determining, what we can do to do more to support your interest in New Zealand. How is this logical for developers when land cost is so high? I hear what you're saying. And I don't know land cost in New Zealand, but I can tell you land cost is highly variable in the US, and there are I was talking to somebody, a provider in Santa Barbara, California, and she was talking about their land cost there and really determining what they can do to really kind of make this happen. So I don't have the answer to you there, but I can tell you that when you do build something like this, we've got a developer in Arkansas who has got 53 greenhouse homes across the state. And obviously, land cost in Arkansas is much cheaper than it would be in, say, New York or Santa Barbara. But he can tell you that the return on his investment of that land has certainly made a difference. So happy to brainstorm with you to figure out how could you make it work. And are there incentives? Are there other funding streams and mechanisms that could make something work? I don't know the politics, and I certainly don't know some of the other economic factors that might weigh into that, but certainly happy to entertain the conversation when there's interest. I believe where there's a will, there's a way, and somehow, we've got to amplify our voices to be able to bring the change that we all want for ourselves and certainly for the elders that we are supporting now. So, with that, I think I've got a minute left. I really want to thank you for your interest, for your time. I really, truly mean it. I hope you will reach out to us. We are very eager to support your interest and exploration of the model, and happy to do anything and everything that we can uh, to support you in your journey. So thank you. I want to thank my colleague Janet Wright for staying up with me tonight and doing this webinar with each of you. And we look forward to one day, I hope I'll get to New Zealand and be able to meet you in person. But until then, take care and have a wonderful afternoon. Thank you, Lily. Appreciate it.